Hello, tonight I want to talk to you about an abscess and how that would be treated in the foot and ankle. So yesterday we talked about paronychia, which is a localized abscess or an inflammation or infection to the border of the nails. An abscess could be any location, so in any area where you have either an infection or some kind of an inflammation. There are multiple types of abscesses that can happen in the foot and ankle. There's some that are called sterile abscess, which would be an inflammation or something that's walling something off that really doesn't have an infection, but just the inflammation and all the inflammatory cells to actually help in the treatment of, say, a foreign body. So we've talked about foreign bodies in the past. And if you have a foreign body in the area, sometimes the body will wall that off and it will have an inflammation. And as you open it up, it'll even have draining out that looks almost like pus with no infective matter in the area. It's just an inflammation. So that could be the case in some individuals. And it's a sterile abscess. Number two would be really an infection. So like the paronychia that we talked about, paronychia is a lot of times is an infection in the border of the nail. An abscess where you get an infection can also be the case. Third type of abscess a lot of times can be something similar to, it can be infection or could be just a reaction to some type of an insect bite or something. Basically what you have a pocket of inflammation that could be infective related or not that needs to be treated. There are really three ways that we will commonly treat an abscess of the foot. The most effective way is to drain it, to basically open it up and drain it. Most of the time that requires opening the abscess up through making an incision into it and draining it out. Number two can be just treating the infection and having the body resolve it. The body will kind of clean it out through antibiotics or something like that. The third is to create a way to pull the abscess out. And in some situations, some types of abscesses, soaking in warm water and Epsom salt will do that job. So if you have a local area of inflammation, pain, and swelling, and it seems to be a pocket of fluid, that a lot of times can be an abscess. And you can treat those abscesses by draining them, treating the infection through antibiotics or something similar, or soaking. So if you have a possibility of an abscess, it's probably worth getting evaluated and making sure that that's not what's going on, or getting it treated if it is. This is Dr. Brand Gibson, and this is your podiatry tips.